Okay, welcome everyone. I am very excited today to have one of my colleagues from my doctoral program with us today. And we're going to be talking about a topic that is very near and dear to her heart. We're going to be talking about how we can support the mental health of our veteran and military populations. So we will dive a little bit in, but I want to give an introduction to our guests today. We have Venus Flowers here, who is a clinical social worker with the VA. So let's do some brief introductions. You all know me. I'm Megan Mitchell. I'm not going to read to you everything about me, but I am a child and teen psychotherapist in private practice. I also founded Agents of Change Social Work Test Prep, and now we have moved into the CEU space, which we're really excited about so that we can provide quality trainings to social workers out there. And a little bit about my interests. So I'm really happy Venus is here because I do not work with the veteran population. I work with kiddos, but they are in some way affected by this. So it all intersects somehow. Some of my other interests include technology and innovation, how we can use technology and incorporate it into social work practice. And then also I'm interested in multicultural supervision, ethics, and ensuring diverse voices are heard in supervision and consultation, which we are going to touch on Venus because I know that's super important to you and what you're interested in as well. And then lastly, I am a DSW student at SUNY Buffalo, and Venus is also in the program with me. We are almost halfway through, which is a really, take a sigh of relief for that one. It's been a journey. And then we have the amazing Venus Flowers here. Venus, and I will read this because she is very credentialed here. Venus is a dedicated clinical social worker with a passion for serving others and making a positive impact on the lives of individuals in need. For the past 10 years, she's had the privilege of working in the Department of Veteran Affairs, the VA, where she specializes in behavioral health, homeless veteran services, and VA peer support programs, which we'll talk about a little bit in just a moment. She also was in the Army in Air Guard. So she is a veteran herself, which makes this topic as a lived experience so much more important. And she also is committed to supporting and advocating for veterans throughout their journey. I'm sure it is a lifelong journey. Mm-hmm. And then beyond this work she does, because, we're never busy enough as social workers. She is in the DSW program at SUNY Buffalo, and she is looking a little bit more at race-based stress, as well as implementing anti-racism strategies and working towards cultural humility. So Venus and I have a lot of overlap in some of the areas that we're looking at. And Venus believes that creating inclusive and equitable environments is essential for the well-being and success of all individuals, and she's dedicated to promoting social justice and equality. So welcome, Venus. It's so great to have you here today.
Thank you for having me. I appreciate it.
Yes, so that was a lot, but like I said, it's very important that we highlight all the amazing things that you've been doing. So before we jump into the good stuff, I want to go over our learning objectives today. Participants will be able to analyze and identify barriers to mental health care for veterans. We're definitely going to talk about that. Participants will assess peer support. I'm really excited to hear more about what is going on in that program, including military culture's influence on mental health, because we're going to get into this, but there is mainstream culture and then there's military culture, and that is probably a difficult line to walk at times. And then lastly, participants will develop strategies for enhancing mental health services, emphasizing intersectionality and cultural humility, one of our favorite things to talk about. So that's a little bit of where we're going to go. And then lastly, why is this important? I mean, we don't need to really say, but working with this population is incredibly important. Why is it important? Because I think you're going to probably get into this. Veterans experience distinctive challenges, and we are going to talk about culture and a lot of different systems and policies and procedures that go into that. So we will discuss that in detail. Lastly, we as clinicians, we want to reduce the stigma and allow our clients to break down those barriers to getting treatment. I think that at least you can correct me if I'm wrong, we've come a long way and we're
We
continuing
have.
to make strides, which is great. And then lastly, we want to, as clinicians, promote equity, inclusivity. I mean, that's always a guiding principle of social work. So I will be very curious we're going to talk a little bit about intersectionality and how military culture brings in intersectionality, because I can imagine that's another layer to discuss
Mhm.
a little bit further. So without further ado, let's go ahead and jump in. Venus, tell me a little bit about, you've been working in this area for 10 years. So just tell me a little bit about how you got here and why you got here.
Oh, perfect. So basically, when I completed my master's of social work, went from there to a residential treatment facility for at-risk youth. And I was working with that program when I heard about mass hiring efforts for the peer support program within the Veteran Affairs. It was veterans helping other veterans, and it intrigued me. And though it wasn't a clinical role, I wanted to get my foot in the door and be able to use that as a jumping pad of sorts to continue to help and work with other veterans. And so I started at the VA as a peer support specialist on an inpatient unit for about a year. And ultimately, after that year, transitioned into clinical social work and behavioral health. And I just kind of hit the ground running from there. I had a plethora of opportunities from doing marriage and counseling therapy at uh, the vet centers, and then coming back and taking over the peer support program at the VA, ultimately working as going from there and working as a social work supervisor for the homeless program. And then
You
now
really didn't know.
working with the Veterans Crisis Line now with their peer support outreach center, where frontline staff are the peer supports, and I'm a clinical consultant on that team to help them make the best decisions with suicidal crises.
Awesome. I remember when I was getting my MSW, those VA positions and internships were incredibly hard to get. I just remember there'd be like only a couple slots and it was really competitive to get those. And then I remember people really wanting like to work for the VA after. So like you said, you got to get your foot in the door sometimes and build up from there.
Indeed, because I didn't get an internship. So I didn't get an internship. So I was happy to be able to use peer support, not just to learn about what it was and being able to support veterans, but also use it as a jumping pad, I guess.
Yeah. So I know that you yourself are a veteran and now you work with that population. Tell me a little bit about how your own lived experience brought you to this work or drew you to this work.
Hmm.
And I think that's super important. So tell me a little bit about that.
Yeah. So while I was serving with the Air National Guard, I was a flight medic, and we would deploy, obviously, and bring wounded soldiers back to the States. And I was a part of the East Coast drop, my particular unit. And so we would drop them off at BAMSI in Maryland, which is the burn center in Maryland, or I think we did some drops at Womack, and it was another facility as well, and now it's escaping me. But essentially, we brought wounded warriors back to the United States. And knowing what to do with those we called our litters, right? The medical emergency. So those were the ones who had to be carried onto the plane. The ones who typically had mental health concerns, we called our walkie-talkies, right? They could walk, they could talk, we could support them in that way. I didn't always know what to say.
Yeah.
And I always felt this desire to know how to help them. I knew what to do with the litters. I had that down. I could do it in my sleep. Um, but dealing with people who were having mental health uh, crises and circumstances, I was just drawn to that. And so that led me to the desire to go into the counseling field. Social work provided the best avenue for me,
Mhm.
being a Fayetteville State University out of Fayetteville, North Carolina alumni. They had the program. And so it just seemed like a natural transition for me to go from my master's there since I'd already completed my bachelorette. And it opened up the door for me to start making this way towards not just being a veteran,
Mm-hmm.
um, but continuing that work in the VA.
Mm-hmm. And so it sounds like your past experience definitely pushed you towards this work and informed
Mm-hmm.
your work. Do you feel that having that experience that you did on the medical side really helped you understand the systems a little bit better than maybe someone that does not have that experience at all?
I can absolutely say it helped me in that there's a camaraderie
Mm-hmm.
among soldiers, airmen, seamen, that it naturally trickles down into the veteran population when we're working together. And there are things that you can talk about all day long, but if people don't understand the magnitude of what that was like, then it's hard for them or you to feel that they fully grasp what you've experienced. I always say, for instance, like when you deploy, my husband works civilian, so he would be overseas as well. But when we deployed, if they started attacking the base, he was sheltered and put somewhere, and civilians were removed immediately.
Mm-hmm.
Soldiers were given weapons
Yeah.
and told to prepare. And so there's a different mentality that you take into
Yes.
that. And so being able to understand that part of it, like I understand why you're anxious,
Mm-hmm.
why you feel lost, why you're suffering with depression, even though you never fired your weapon.
Mm-hmm.
Whereas a civilian may not understand that.
Yeah. And I think that's huge. And I think that someone with lived experience can relate probably at a different or in a deeper level than, like you said, someone that has not had that. It's that camaraderie. And I've been there. I've been there. So I know type of thing, which kind of leads me into our next thing, our next topic. Does that play? Tell me a little bit more about the peer support program that you have
Mm-hmm.
been involved in. And it sounds like that would be something that would be more beneficial because it's peer to peer versus a different power differential. So tell me a little bit more about the peer support program, because I am not familiar with it. And like,
Right.
what is it?
Right. So basically, peer supports are veterans who, of any of the military branches, who may have been diagnosed. We started out in 2013. It was mostly mental health work. And so, whether you had substance use disorder, whether you had depression, anxiety, PTSD, any plethora of diagnoses that may be affecting you, and the lived experience that you had from pre-diagnosis to diagnosis to treatment to get you back into a standard or a place of recovery. And
Okay.
that journey that you went on, being able to use your lived experience of that journey to then support others who are in that situation, whether that's someone who has never been on an inpatient unit, someone who's never attempted to utilize substance use treatment programs, outpatient or inpatient, someone who's never been to behavioral health and feels like, oh, I don't want to just go somewhere and sit on someone's couch. And so being able to use your lived experience to walk them through the journey so that they can feel supported, so that they can feel informed, um, is essentially what peer supports do. And there's no clinical book to teach you how to
Mm-hmm.
do peer support. Life has taught you.
Mm.
And so that is the foundation that peer supports operate from.
It's amazing that you said it started in 2013. That's fairly new. That's only been about a decade. And my question is, does this eliminate barriers for veterans or service members? It seems that it would be more approachable. So tell me a little bit more about
Mm-hmm.
how someone might feel more comfortable accessing this support than maybe something more formalized, like you said, like going into outpatient or inpatient or any of those other
Right.
programs that are available.
Absolutely. And so, and even thinking about 2013 is not particularly when peer support started, it's when it
Okay.
started in the VA. And so, where they
Right.
had a huge hiring efforts within the VA, they were utilizing peer supports. Our VA before 2013 had one
Wow.
peer support. And now that same VA has about 15 peer
Okay.
supports. They've also implemented them in primary care, in the pain
Mm.
clinic, not just mental health, homeless programs, what we call MICA, mental health intensive case management programs. So, in a lot of places.
Yeah.
And so, um, why someone would use peer support versus the clinical realm. I like to think of peer support as kind of a soft buffer,
Mm.
right? So they may not be ready to sit on the couch, as they call it, right? But they may be comfortable talking to a comrade about those experiences. And in talking to a comrade, what that peer support specialist is able to do is say, man, it sounds like you're going through a lot. And I just want to let you know, like, I've been where you are, and this is what helped me. You may not be ready because you may
Mm-hmm.
not know what it's going to be like, but can I tell you what it was like for me? And
Mm.
so they literally use that experience to help the peer supports or the person that they're serving um, make a more informed decision. And so it's not jumping in feet first into the
Yes.
psychiatrist or into the therapist or into an inpatient unit or outpatient substance use treatment
Mm-hmm.
facility. It's literally a soft buffering.
Mm-hmm.
And yeah, and that's why I think people typically go to peer support, or, and just to also add, it can be that soft landing coming out of therapy.
Ah.
So when veterans are saying, "Well, I've been with my therapist for a year. I don't want to leave. I don't know
Mm-hmm.
what it's going to be like," because that dependency is
Yes.
there. So now having a peer support who can say, "Yeah, I went through the PTSD program, and I was in your same boat. I was scared to leave, but since I've left and I've been able to form these relationships, this is what's been working for me." And your therapist is still there, just not in the manner that they've been before. So again, sharing that lived experience to be
Yes.
that soft landing after therapy.
A note I wrote down is, and I put it in big letters, is validation, like validating that experience for someone. And we know that validation is step one in anyone entering treatment. And you're not going to enter treatment if you don't feel validated, heard, supported, connected. So I think like that validation piece that you said, like, I've been here, I get it. That can be huge.
Right. I worked with a veteran when I was a peer support specialist on an inpatient unit. We didn't even have the same diagnoses, but we were both veterans. We were both
Mm-hmm.
Army veterans at that, right? Because I served Army and Air Force. And so I would literally hang out with her on the inpatient unit while she was there, hear her stories, not be non-judgmental, uh,
Mm-hmm.
validate her experiences, be able to share. There's a lot of reciprocity there,
Mm-hmm.
be able to share with her and be able to challenge some of the stigmatized thoughts that she had. Like, yeah, my family said I'll never be able to own a home or get married, or I can't, live alone. And, we know that's the stigmatized idea about what it means to have mental health, that you can't function in society.
You can't do this, you can't do that, not what you can do.
Right, right. And so being able to be with her on that journey and tell her, hey, I've had these experiences. I've also had a diagnosis, and look at me. And she's like,
Wow.
are you lying? And I'm like, no. So you're literally like me. You've been diagnosed. And I was like, yeah. And she went from there to having repeat inpatient units prior to literally going into a DBT program, buying her first home with her VHA home loan, becoming a VA volunteer in the local VA. And every time she would see me in a hallway, she would just be like, Venus, thank you so much. You let me know I could do this. You were my proof. So we actually took that, and part of what came out of the concept of being the proof are I am the evidence buttons. And so all of the VA
Mhm.
peers would wear, I am the evidence,
I love that.
because recovery is possible.
It also seems that it really, in some cases, probably comes full circle. People that were connected with a peer that they really benefited from that relationship probably go on to pay it forward again because they had something positive. Do you see that happening, that someone had a really positive experience and then they want to go on and be someone that can be of a
Yes.
support
Oh,
too?
absolutely. When I became the peer support program coordinator for all of peer support in our VA that I worked in, I literally had therapists coming to me saying, "Hey, I'm seeing somebody. We're ending our services soon. I think he or she'll make a peer support specialist. When are you hiring? Or if you're hiring, consider this person."
Amazing.
And so, literally, being able to connect them with volunteer services so they can do some work with some of our actively employed peers and see how they engage with them, see how they engage with the veterans, and eventually get them hired. So we've definitely seen it come full circle.
That's absolutely amazing. And I'm wondering a little bit more, how would someone, how do you get the word out that these programs exist? How do you let people know, you know what, you don't have to fully jump in to this thing, but like we have this a peer that can talk to you. How do people know about it?
Right. So they are embedded into many of the programs within the VA now. And so we have peer support flyers. We have a national peer support program within the VA. They send out monthly newsletters. They send out training invites to leadership, who then pass it down to frontline staff. We do our peer support month, which is just last month in October. We do a huge celebration for peer supports and keeping the word out there. We actually have some peer supports who will walk around in waiting rooms and just kind of
Hmm.
interact with the
Yep.
veterans. And they're like, "Man, you're here every day. Who did you say you were again?"
Yeah.
And they let them know, "Hey, I'm a peer support specialist. After your appointment, if you want to talk, you have any concerns, come down to my office. I'm in, you know, room 102 or whatever."
Yeah.
So sometimes it's word of mouth. A lot of times it's the nurse, the
Mm.
clinician, the psychiatrist, telling them about these programs, the case managers, that are literally telling them that I got somebody I want you to talk to. He
Mhm.
served as well. He or she served as well. And it
That
starts
that
the journey.
Yeah, and it's so interesting to me that you have kind of worked through all of the different stages and seen different. You were a peer support specialist, and tell me a little bit about how your journey has brought you to now you're doing consulting work for it. So obviously it's something that's very close to you and you're passionate about. So tell me kind of how that journey brought you to where you are now.
Yeah, so absolutely. So um, being in the homeless program and working with obviously homeless veterans, and had a couple of peer supports on that program as well. I basically got word that they were opening up a peer support outreach center
Mm.
where peers would be the only frontline staff engaging with veterans in crisis who have used the Veterans Crisis Line and perhaps had a wellness check sent out to them. And then our peers follow up within 7 to 10 days, literally to say, "Hey, I just want to check in with you. I know you've called the Veteran Crisis Line. I want to see how I can support you in your continued journey of recovery." And so when I heard about this program, it just felt like a natural fit.
Yep.
So I immediately applied when it opened up, went through the process, and came on board. And so essentially, because they also have, this is one of the pretty much the biggest employer of supervisory peer supports in the VA.
Wow.
They are housed inside the peer support outreach center because the clinical consultants don't supervise the peer supports. If you
Mm.
go on site, more times than not, if you go to the local facilities, they are being supervised by social workers or by psychologists.
Right.
And it can sometimes muddy
Yep.
the blur the differences between the disciplines. And
Yeah.
so to have peer support supervisors supervising them, the peer support specialists, and the clinical consultants coming on to, let's just say they have someone who is, they're not sure if they're suicidal because they're kind of like, I don't know, I want to go to sleep and I don't want to wake up, or, today's been a really tough day. I don't know if I'll see tomorrow. So
Yeah.
they're making statements that maybe the peer support doesn't know how to interpret. It
Mhm.
can immediately IM a clinical consultant to say, hey, this is what's going on. What should I do? Right. So that's an option for them. Obviously, they have been well trained on
Yes.
how to respond to suicidal crises, to understand warning signs, and then how to get them reconnected to the veteran crisis line if a wellness check is needed again, and then normalizing that process. Like, the veteran has, you came to us because you needed to use the veteran crisis line. We're offering you support, and if you have to use it again, that's okay. That the journey is not linear. It's not you start at
Yes.
A, you get to B. It's a very um, diverse journey for a lot of people.
Mm-hmm.
And so the peer supports are able to um, normalize that for
Mm-hmm.
them in their journey. Yeah.
that that I like that you gave like an example of what a consultant would be providing or doing, which I think is such a great support for the peer support supervisors as well, that every layer has someone that can like give you expertise or advice or help you along the way. And something you said, I like that you said the journey's not linear, right? It's not linear. It's not that you start here and you're here. That's
Right.
not how
I'm
life
healed.
works. Yeah, that's not how life works. We all have our own individual journeys, and I really like that you said you've called before, and that's okay, right? It's like, thank you for using this service. We're here if you need us at any time. You need to call us again, we're here.
Right, absolutely. And knowing that someone's going to follow you. So
Yes.
with our peer support, it's not just on the Veterans Crisis Line. When the veterans call in, it's that one call. And
Mm.
you send that person may send out the wellness check. You may go through 100 different responders before you ever talk to that responder again.
Yeah.
But with the Peer Support Outreach Center, they're calling you every week, once a week, to check in on you, to see the goals that you've set. What are you doing to meet those goals? How
Mm-hmm.
can I assist you? Do you need resources? Do you need, information? And again, helping them to get to that journey while normalizing all of the stuff in between.
I love that the follow-up is there because not just in this system, we know in mental health in general, like you could talk to 10 different people, and if you are struggling, if you're in crisis, you're depressed, you're not going to jump through hoop after hoop after hoop to get the support. So I think that it streamlines this a lot, so that it's eliminating the barriers to access is really what it's doing. It's making it accessible.
Yes, absolutely. Um, and um, the criteria for being able to use the service is not as strict as it would be in the VA hospital, where you have to be general under honorable or honorably
Mm.
discharged, or in acute chronic suicidal emergency. For the Veterans Crisis Line, if you served one day, you're a veteran,
Wow.
and we're going to provide outreach services to you.
That's amazing, because I have heard that sometimes if you're going the route of like scheduling an appointment with the VA, it can be
Mhm.
years. I mean, it's long wait list. So this is so accessible, and it's much easier than having to wait, and get an appointment here. And so that I really appreciate. I do have a question, because you kind of touched on this a little bit. How does military culture affect the way veterans can access services? What are some things specific to military culture that either prevent access or restricts it a little bit?
Right. And so I think one of the things that can be a barrier because of the military culture is the stigma that's put on needing help. You
Mhm.
are not encouraged to go to sick call. You are not encouraged to, oh, you feel a little suicidal today. Um, let's see if we can get you someone to talk to. Um, so let me say it's getting better,
Mhm.
that service members are being treated a lot better and being provided a lot more resources. In times past, as some of the culture that you continue to see, we want you to be rock steady, right? We want you to be so focused and so capable to
Yep.
move forward through whatever this journey within active duty service or guard or reserves is going to take you. And you can't do that if you're focused on your anxiety, if you're
Mhm.
focused on your nightmares, if you're focused on your substance use disorder, right? And so those are things you just don't talk about. And actually, those are things that can get you put out.
That's the huge thing. Like, I don't think a lot of people, so tell me a little bit about that. How, if you actually do ask for help, you could be out.
Yes. So there used to be if you come to us and tell us that you have a substance use disorder, uh, we'll put you in treatment. After treatment, you may be able to stay in. Um, that hasn't quite been the case
Yeah.
for a while. And so they're shifting from that mindset. So it's almost becoming a zero tolerance policy. So if you talk about it, that doesn't protect you, doesn't protect your career in most cases. Um, and so the 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 active duty component of it, and I say active duty also meaning guard and
Mhm.
reserves, the mentality around um, having mental health crises and such is not as supportive as it could be.
Yeah. And it's going to take time. It's going to absolutely
Yeah.
take time. So I'm happy to see we're making little baby steps as we move forward.
Right.
But
Yeah. When
yeah, I could even hear in your voice that you were like really contemplating this. Like, for me as someone that's a clinician and I'm like, yay, mental health, it's just so different mindset than what we're taught in our social work programs, right? It's like, of course you need to be well in all aspects of your life, but that's not the culture that veterans and active
I'm from.
come
Yeah,
from. It's just it's actually
absolutely.
completely opposite.
Yeah, you can be seen as weak. You don't
Yeah.
want to be seen as weak. You don't want to be the sick call warrior, as they may
Yeah.
call you. If you have to get a profile, which basically means like I can't do push-ups or I can't do sit-ups or I can't do whatever it is you can't do. You are seen as weak and you
Yeah.
are seen as a defective component to the unit and what they need to get done. And so it can be something difficult to shake. And so when you hear about the VA, you don't separate the two
Right.
initially. You don't ask for help, right? And when you do ask for help, you do it in a manner like, oh, I got it. Yeah, this is bothering me, but it's nothing. I'll get through it. And so it takes those conversations, it takes those ability to see through the toughness to
Mm-hmm.
be able to say it's okay
Yeah.
to not have the answer. It's
Mm-hmm.
okay to be struggling. And this is what we're here for. So, really trying to shift that mindset from it's not okay because I'm weak to actually strength is recognizing
Yes.
and moving towards the journey instead of away from the journey.
Yeah, and something when you were saying that that came up in my mind is being vulnerable. It sounds
Absolutely.
like it had someone that is accessing these services or even taking the step to do it, that's a huge step in being a little bit vulnerable, because that is just huge, coming from that culture to say, you know what, I do need some help. That is just, you have to be really vulnerable, and vulnerability is a scary place to be.
Yeah, yeah, definitely. We, the military to veterans, and they used to call it the post 9/11
Mhm.
program. So we've definitely developed programs over the course of, these last 10 or 15 years that support that transition. And even in active duty service, they have the wounded warrior transition units that help veterans do kind of like a smooth transition from service if they've been wounded into civilian sector, into VA healthcare. So we do have programs that support the transition. What we've learned is sometimes when veterans are, let's just say, general under honorable, maybe they did pop hot for smoking weed and they
Mhm.
were a zero tolerance incident. And so the command put them out. And so they were in 1 month, and 2 weeks later, if they're lucky, they're out. So they're inundated with a lot of information and then put out, and
Then what?
and then what? And then you have that call to the Veterans Crisis Line. I'm
Yes.
homeless. I'm dealing with addiction. My wife left me.
Huh.
My kids don't see me. My family doesn't get me anymore. And it's
Mm.
like, that's when you realize they don't, maybe they don't know about the services that are available for them, and how can we wrap that support around them.
And we know when we're in crises, we're not able to access thinking at the highest level. So when you're in crises, think of how much mental effort, and just from a
Right.
place of bioscience, like it's hard to access that space, like to think, okay, now I'm going to make a plan to reach out for services here. You're in
Mm-hmm.
crisis, you're trying to survive.
Right. Right. And then it's easy to compartmentalize that when you are deployed. I myself never had to fire a weapon.
Mhm.
Though I've been deployed with the Army, I've been deployed with the Air Force. Um, and so it's easy to be in theater and create a degree of separation between my military family who is here and who
Mm.
I have to support and who I have to be prepared to go into battle with, whatever battle means for me, and my family back home. And so you have to compartmentalize it in a way. Um, and I don't know the best way to articulate that. Um, but your main priority is the people who are in the desert with you.
It's got to be so hard to separate those two things. So that does take a lot of mental toughness. And I think that's probably why the military culture is the way it is, because there's an end goal,
Right.
right? That you have to, that's what you're there to do. And, but like you
Mm.
said, but then there's people back home too. So it's kind of dancing two lines, and that's got to be really tough to
Yeah, because when you
show
come
those.
back home, now you have to do the switch again.
Now you're, yeah,
Right.
it's a
Now you
lot
have
to
to
carry.
switch to my family. And, my husband wants me to go to the parent teacher conference because he's been doing it for the last 6 months or the last,
Yeah.
year. Or just all of those things that you have to do to connect with your actual family, to make that mental shift. And sometimes that's easy. Sometimes it's not as easy.
And I could see it being hard on both sides, for the person transitioning back and probably for the family, because they didn't have that same experience. They might be expecting, you've been gone, now you got to come back and just pick things up like where you left off, which I can imagine. So on both ends, it probably takes a lot of understanding and reworking and relearning things on both ends.
Mm-hmm. Yeah, absolutely. Absolutely.
Yeah. There, like, I could just talk to you forever about this Venus, because this is so interesting to me. But the, like, I could not end our conversation without talking about intersectionality and multicultural diversity. How does that play into things when a veteran belongs to military culture and then they identify with being from another different groups. So maybe they're a person of
Marginalized.
color, maybe they're a woman, maybe they belong to the LGBTQ community. How can does the peer do peers get matched with someone that maybe is a similar identity? How do you think intersectionality works in these type of programs, or how do you envision it could work well in the future?
Right. Right. In an ideal world, I think we would love to be able to match, right,
Yep.
for that specific criteria. Unfortunately, we can. There are some people who may specifically ask for someone who is of color or someone who is LGBTQ or a woman. And so where we can match, we absolutely
Okay.
try to adhere to the veterans' desires. If they don't come in with that desire, then we try to place them accordingly, right?
Mm-hmm.
Beauty of the military is that, and especially now that we're away from I was a part of the Don't Ask, Don't
Mm.
Tell military time
Yes.
frame. And so to be able to be who you are, to be able to articulate your experiences and find support in the organization is a totally different perspective, right? And so we try to trickle that down into the VA as well, that support, that understanding. It's one thing if you're a civilian and you are at work and, someone is handling you a certain way because of your gender or your sexual
Mm-hmm.
preference or, your color. Um, you can complain but you can't quit, right? It's not like at the civilian job you can say, you know what, I'm going to work somewhere else, and you can be
Right.
out of that job within minutes and at your new job wherever you land, right? In the military, it's not that easy. You endure the harassment, the comments, the stigma, the shame, and then you come out into the civilian sector, right? And you're no longer in the military, but you're still a part of the LGBT community. You're still a woman. You're still a person of color. And so the only difference is I couldn't walk away then,
Mm.
but now I can walk away. And so a lot of times you will see veterans who are jumping from job to job to job
Mm.
because you won't have me stuck anymore.
Yeah. Have you seen that in your experience that can kind of be freeing? It's like you don't have to be tied down anymore. Like you have that autonomy to choose if you want to. Have you had any like experiences where someone's like kind of facing that for the first time? Like, oh, I do
Oh,
have that choice.
yeah, and you do see a lot of veterans go into veteran-owned businesses
Hmm.
because they want to be their own,
Yeah.
boss because of the
Get that.
experiences
Yeah.
perhaps that they've had. And a lot of these veterans go into veteran helping veterans because they want to be a different perspective, a different experience for those who have served. But working on the detail that I'm currently on, which is called HEARTH, helping with employment agency risk and transition. So it's a HEARTH program in homelessness. And so what we're doing essentially a new program in the VA. Hopefully, we'll get it fully operating. But once the veteran is discharged, general under honorable, other than honorable, we're able to connect with them, inform them about the resources that are available for them, wrap that support around them, connect them to the services if they need to be connected, get them enrolled in VA care.
Mm-hmm.
And really start to break down the mentality that they come from and help them effectively transition into the civilian status.
Mm-hmm. I have a question. So you have the lived experience, but what advice would you give to someone does not have the lived experience and maybe not even working in the VA, but maybe someone that is a veteran comes into their office? I can imagine some people would feel really uncomfortable broaching some of these issues with people, right?
Mm,
What advice would you give someone that like maybe doesn't feel super comfortable? How do you practice cultural humility? How can you be present with the client? And how can you ask questions without causing more harm? I know that was a lot.
right. No, yeah, I think the key is really acknowledging that when you really think about the percentage of people who have actually signed on the dotted line, and I want to say the last time I did the numbers, it was somewhere around 7 to 9%
Okay.
of the population in the United States that have actually signed on the dotted line. And I think the key is acknowledging, regardless of what your job was, you signed on the dotted line.
Wow.
And acknowledging and validating that that was something that not so many people have decided to do. Because a lot of times people think, well, I wasn't combat, or I
Mhm.
wasn't infantry, or I wasn't special forces, so I don't matter. And I
Right.
think when you lead from a place of you do matter because you signed on a dotted line, that opens the door for them to feel comfortable enough
Mm.
to at least acknowledge that, yeah, I've had some experiences.
Yeah. Once again, bringing back validating,
Mm-hmm.
validating that you did this thing that
Mm-hmm.
very few people do. That's huge,
It
right?
is. It really is. Yeah. And so asking the questions, and one of the things that we do in the Hearth program now is how can I best support you? What are your goals, right? And what does that look like in our time together,
Mm-hmm.
right? How
Yes.
can how I support you as opposed to let me tell you what you need to do.
Yep.
They've been
And
told what to do, what to wear, what to dress, how to
that,
dress.
and that's that power differential, right? I think that is so important. And something I've been studying, which you know is multicultural orientation, which is not
Mhm.
being competent, it's being humble. How can we be
Yes.
humble, especially if you're someone that is not a veteran yourself? I imagine letting the person know, you know what, I do not have the experiences that you do, but how can I support you? I'm here to understand and to be with you in whatever way you need that to be. I think that that's what I see it as being with the client rather than, telling the client what to do or pathologizing the client. I mean, how many times do we pathologize? It's not about that. It's about
Right.
being with. It's about connection, the human connection. To me, that's what it's about. I don't know what you, I mean, you have a very different perspective than I do, but as someone that has not served, that is how I would approach it. And I'm glad that you gave some advice.
Hmm.
But what I also would say, I'm sure if people are feeling stuck, they should probably seek a consultation, right? Of some sort, right?
Absolutely. Absolutely. I think we at the VA, we have a plethora of providers who are not veterans, who
Hmm.
still find ways to connect with the population that we serve. And so I think that um, obviously finding ways to get them connected to, whether that's starting with the peer support specialist, maybe starting with nurse management, perhaps it's starting with, the clinical therapist or psychologist, whomever, but letting the veteran decide the pathway that they want to utilize. And sometimes that doesn't mean I want to go to inpatient treatment if I'm not a threat to myself or others.
Mm-hmm. I also was just thinking about, we know identity is different for everyone, and the person might be coming into our office and that might be part of their identity, but that might not be what they just want to come and talk about all the time.
All the
I
time.
see that
Right.
as a mistake so much people make. Like, for example, maybe someone comes into their office and the person is neurodivergent. That's my population. So maybe they are an
Mm-hmm.
autistic individual, and the provider thinks, I got to talk about that all the time. And then
Right.
the patient, the clinic, the client is like, that's one part of my identity, but that I'm a whole person. So I think asking them,
Right.
like you said, well, how can I best support you? Because maybe they are wanting support in a different area.
Absolutely. Absolutely. And a lot of times, it may be family oriented because the
Mhm.
family understand them now and what they've been through and they can't talk about it. It may be job, it may be housing, right? But yeah,
Yeah. So I think just meeting the client where they're at, and I always say this all the time, it's what they need and want, not what we need and want. And that can be
right.
really hard. We get very uncomfortable, but as clinicians, we have to sit with discomfort. That is part of the job. Like, we
Mm-hmm.
can't let our discomfort affect our way of being with the client, which is what I think is all about being culturally humble.
Right. Absolutely.
Hmm.
Absolutely.
Well, I'm sad that our time is coming to an end, Venus, because we could talk about this forever, but I guess we will leave. I want to ask you one last final question. Um
Mm-hmm.
if I'm like brand new to this, are there any websites or anything I can do to kind of just get a better sense of what's going on? And I'm sure, does the VA put out resources? How can
Yeah.
I educate myself a little bit more, or even just start to scrape the surface a little bit with working with this population?
Absolutely. So the VA does have a site, the va.gov site, and you can
Mhm.
find a plethora of information from even more about peer support specialists, PTSD, VA apps that veterans use for self-management of some anxiety, depressions, and even PTSD and anger management. But I would say the va.gov is the best place to start to learn about as much information because it's a diverse amount of
Great.
information available for someone to start. Yeah,
That
and
will keep someone busy for a while, just
it
poking
will. It
around.
absolutely will. It'll give you a lot of different programs and resources that are available to veterans and their families.
And I would encourage everyone, even if you don't, I don't directly work with this population, challenge yourself to go out there and learn a little bit more, right? That's the whole
Yeah,
purpose of being lifelong learners, especially as mental health providers, is sometimes the best trainings I go to are ones I have absolutely no connection to because I have to be vulnerable and step outside my comfort zone and learn.
right,
That's what it's about.
right. Absolutely. Absolutely.
Well, yes, Venus, this was absolutely incredible. I just thank you so much for sharing your time and your expertise. And I think what you're doing is so amazing. And I will be so interested to see in just even a few years how services, my hope is that, 10 years from now, we're in a very
Mhm.
different place than we are now with getting veteran support and giving them those wraparound
Yes.
services and learning more about how we can best support.
Yeah, I'm sure we'll definitely continue to grow and build that support around the veterans. So I'm with you. It's gonna happen. We're continuously getting better and more is to come.
Yes, thank you, Venus.
Thank you for the
And
invite.
yes, and for everyone tuning in, I have put just some key resources that are new, as you can see here. I want there could be a
Hmm.
you the VA is so full of info because they get a lot of grant money to put out research. There's a lot of research going on in the VA, so check it out.
Right.
There's a lot of good stuff going on there. So if you want more, I'm gonna link
Hmm.
to the va.gov, but I
Thank
just
you.
encourage people to check it out. And Venus, thank you for spending the time today, and I really appreciate the insight you've provided.
Thank you so much. Thanks for the invite.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.